It's time to go on the record with WRAL News.
Thanks so much for joining us for On the Record. I'm your host, Lena Tillett. I hope your bellies are nice and full from Thanksgiving. I can only imagine the very spirited debates you had around the dinner table this year. And I've always played the role of peacemaker, so I wanted to share a statement with you that perhaps we can all agree on. America has major trust issues right now, serious trust issues, at least when it comes to our institutions. A Pew Research Center survey shows just 16% of the country says they trust the federal government at least most of the time. 16%. That is a 70-year low. I'm sorry to say, trust in the media isn't great right now either. A new Gallup poll showing just 32% of the population has confidence in the media to report fairly and accurately. That is a historic low. Even American confidence in the military is at its lowest point in 2 decades, now sitting at 60%. Here's a trust number, though, frankly causing alarm in the medical community. A Pew survey this month shows the percent of American adults who say science has a mostly positive effect on society now sits at 57%. That's down from 65% in November of 2021, 73% before the pandemic. And when they drill down on this question, trust in scientists is lower than before the pandemic, with more than 1 in 4 Americans saying they either don't have too much or they have no confidence in scientists. The author of this Pew study telling CNN the pandemic is to blame for growing mistrust. She pointed to message fatigue and an influx of conflicting information during that time. Now, I did my own unofficial poll in the Village District, asking folks around here how they felt the medical community communicated during the pandemic. Take a listen.
Yeah, so first of all, I think we have to understand that this was unprecedented. So it had been years since any kind of global pandemic we had faced that. And so I think, from me at least, I have to understand that we probably were not as prepared as we could have been going into a global pandemic on some standards around how do you communicate. And I think what was probably the hardest thing about that was you were getting information from so many different sources that it was hard to know who to listen to.
Did you feel like medical professionals were confusing, or just like all the information out there was confusing?
It was so much and it was so late. So I kind of figured I was listening to Dr. Fauci, et cetera, but it's still all medical jargon. We handled it, but the information, I don't know. It's a little confusing because layman's terms would help.
And tonight, 3 top leaders in the medical community are here to talk about where messaging went wrong during the pandemic and the real-world impact growing mistrust and misinformation is having on public health right now. Joining me in studio is Dr. Charlene Wong, Senior Advisor for Health Strategy in the Office of the Director at the CDC, formerly of the state DHHS. And Dr. Brian Southwell, an adjunct professor at Duke School of Medicine and lead scientist for the public understanding of science at RTI International. Also joining us via Zoom is Dr. David Wall, an infectious diseases specialist at UNC School of Medicine. Thank you so much, all of you, for joining. So, Dr. Wong, looking back at the height of the pandemic, do you share some of the feedback that you heard from those 2 people there? I mean, that some of the messaging was a bit confusing and there was too much medical speak?
Yeah, when we think about some of the lessons learned during the COVID-19 pandemic, I think there are some things that we're putting into place now. The first is we do need to and are getting simpler and clearer in our communication. So, for example, right now at CDC, we're overhauling our website, reducing the amount of content by at least 60%, because if someone's going on our website looking for a specific piece of information, we want it to be as easy as possible for them to find that information. The second thing is we also want to be realistic with folks about what to expect. And so, for example, we've got a great wild to mild flu vaccine campaign right now, where it's really clear that the flu vaccine is about reducing the chance of getting really sick from flu and not reducing the transmission of flu. And what we've heard from focus groups is that people really appreciate that leveling with them about what this is really all about. And the final piece is transparency, just like they were saying, right? Letting folks know what it is we know when we know it, and also making it clear if we don't have all the answers yet and there's some uncertainty.
You know, I think transparency is such an important key here. I want to get to Dr. Wall to kind of talk a little bit more about that, because you were our go-to during the height of the pandemic. And in my view, you were honest about what we knew and did not know about the virus or the vaccine. But the thing is, when something changed, a lot of folks would then think that the information was unreliable. So how do you navigate that?
Yeah, no, it's a real challenge. And I do think that part of the challenge for the CDC in particular, and Dr. Wong spoke to this, is there's a desire for transparency. But at the same time, when you're very transparent, you can overload people with a lot of information, including uncertainty. And people oftentimes, and when they're anxious, don't want to hear uncertainty. But at the same time, when we come out with very strong directives, they could turn out to be wrong or need to be tweaked. So I think there's a balance, and you hear it often when people speak who are knowledgeable say, you know, this is what we know and this is what we don't know. This could change. Part of this also had to do with sort of science literacy. And I think maybe during the pandemic, people started to understand a little bit better that, you know, we don't have all the answers instantaneously. And again, making it clear there's things we know, things we don't know. This could change, so stay tuned. Could be a good messaging strategy that I think towards the end of the pandemic, we started to use more.
You know, I think the media also played a role in that, the challenges of messaging at times, too, trying to keep up, I think, with doctors and the medical jargon instead of really trying to think of how to translate this for viewers and for the public when they needed just simple information. Dr. Southwell, so looking at those public trust in science numbers that I showed, I'm sure that was humbling for you all to hear. What stands out to you most about the decline in trust right now?
Yeah, I think part of the story, actually, that we might be missing is that there's still a fair amount of trust in science and scientists. Actually, some of what we've seen with this recent decline is a bit of a regression to where we were prior to the pandemic. In fact, actually, during the pandemic, there was a little bit of a peak, a little bit of an increase in trust in science in the early days. So on some level, there is skepticism out there. And part of it has to do, as Dr. Wall said, with lack of understanding of how it is that science works, how it is and why it is that we ought to trust in these institutions. We need to do a better job, I think, of educating people in that regard. In fact, we know that trust in science, confidence in science, goes somewhat hand in hand with understanding of how these processes work. And so if we can do a better job of being more transparent, explaining to people how it is that the whole process works, I think we'd be in a better spot. But I do think it's important to recognize the vast majority of people still have a degree of confidence in science and scientists and in scientific institutions. We should not lose sight of that, while at the same time acknowledging the concerns that have been raised.
I know you study this, so where is it trending? Do you think it's trending down, or is it kind of stabling somehow?
Well, a lot of the headlines have talked about growing mistrust. And that's a forecast for the future that I'm not sure we necessarily have enough data to know. Okay. I think that we've seen some declines, some important declines, but I also think we'd have to find out what it is that institutions are going to be doing with their public communication efforts. Where are we going to be in the next decades? Every new family that makes a decision not to get vaccinated, for example, is a new family. It's a new parent who's making those decisions for the first time. And that's something we have to keep in mind, that each new generation is learning this all over again. And so maybe we can renew some of the relationships that we've had with people in the past, and that actually might suggest a stronger forecast for the future. So it's tough to know.
I want to talk a lot more about vaccinations coming up. Childhood vaccination exemptions in this country reaching their highest level ever this year. We talked to our panel about the impact of declining trust on vaccine use. Stay with us. Welcome back. We want to talk now about the real-world impact of falling mistrust in science. We got two major headlines this month related to this, I should say growing mistrust, and I want to take them separately here. So first, the proportion of kindergarten students in this country exempted from school vaccination requirements hit its highest level ever, 3%. This is according to the CDC. That may not seem like a lot, but 3% means hundreds of thousands of children in this country are not protected now against preventable diseases like the measles. So first of all, Dr. Wong, I know you're also a pediatrician. Why do you think more families are seeking these exemptions?
You know, it's hard to say. That study that you referenced didn't examine the reasons that folks were choosing to have an exception from their kindergarten vaccinations. Certainly, it's possible that some of the distrust might be playing into this. We also know that for some families, particularly during COVID, there were true barriers to vaccination, right? Challenges getting to a place that was offering the vaccination, time off from work, things like that are certainly a really important part of being able to get folks vaccinated. And so I think there's still a lot more research and work to be done to understand more about what that trend is. But like you said, it's certainly concerning because that means 250,000 children, for example, right now aren't protected from things like measles, where we are seeing outbreaks of measles in communities across the country. And we certainly don't want that to be the case for kids across the country.
Yeah, Dr. Wall, obviously as an infectious diseases specialist, what's the potential impact of all these children not being protected?
Yeah, no, it's extremely concerning. And I know we're talking, I mean, the fortunate thing is we're talking about moving from 95% to 93% of kindergartners being covered with vaccinations that are routinely recommended. But that's a big enough change that it could be a concern. And as we've talked about, trends are everything. And if it continues this way, we could have a lot of sick children who could grow up to be sick, potentially sick teenagers and sick adults and infect other people. So it's really concerning from an infectious disease standpoint. I will point out that the survey or the analysis also showed that there's quite a bit of variability by state, which shows you that policies have a lot to do with this. And we haven't spoken much about policies and also about social media and messaging and sort of the corrosive effects of some of the messaging that has been amplified that allow these things to happen, or at least, facilitate them. So I am struck by the variability that we're seeing and how in some states it's really easy to get an exemption and how in others it's harder. And I do think policy plays a major role here as well.
Yeah, I was going to get to social media because I do think that plays such a huge role. Dr. Wall and Dr. Southwell can speak to this. Look, as a new mom, all of a sudden on my Instagram Explorer page, I am just overwhelmed with the vaccine skeptic videos and the straight up anti-vax videos. And I think about the people who may not be as informed or have access to information as I do, who would think, well, maybe there is something up with vaccines. I mean, how do you confront that directly as a medical professional?
Yeah, there certainly are many false claims out there online now for people to find pretty easily, just a click of a button on their phone. And all that indicates a fair amount of trouble, something we should worry about. The question is, what is it a sign of trouble of? To what extent is this a matter of people being brainwashed and led astray? Or is this a sign that they're looking to try to find ways to keep them and themselves and their families healthy? They're scrambling, looking for information while they're trying to get to their job, while they're trying to figure out how to pay rent. And I think part of the larger issue here is we have to step back and realize this is probably an indication of trouble in terms of the relationships between people and our healthcare system. To what extent are people actually able to take the time to work through advice that they're getting? It's easy to say, gosh, how are these people not listening to their doctor? But for many people, they may not have a personal doctor in these days, in this day and age. That's something I think really important to keep in mind. We have to think about to what extent our healthcare institutions are actually reaching out and have good and trusted relationships with their constituencies. I think we might be in a better place then, and people would be paying less attention to false claims online if they did have a more healthy relationship with the healthcare institutions.
I want you all to hear what this mom told me that I asked about this being overwhelmed by the information online. Take a listen.
It does get frustrating because, I don't know what is right or wrong or misleading or just a rumor or things like that. So it is frustrating.
Dr. Wong, what advice would you have for her?
Yeah, I think we have talked for a long time, both in North Carolina and at the CDC. It's about finding those people who are the trusted voices and messengers. And so for folks who have questions because they see something online and they wonder, gosh, I wonder if that's true or not. Is that true for me? Is that true for my child? It's about finding those trusted messengers. And what we've known throughout the pandemic and to this day, our healthcare providers do remain the top trusted source of information for folks about their health. That's why this year we have been very focused on working with healthcare providers, proactively reaching out to them, because in some cases people don't have a healthcare provider, and in other cases I'm a primary care provider. There's a lot of information that gets thrown at us too, and we want to make sure that they have the information, the tools, the things that they can send out to their patients to make it as easy as possible for them, both to counsel their patients, answer questions about things like vaccines, and then also easy to offer those vaccines in their clinics.
I want to talk about the second headline now, talking about the COVID vaccine, this latest one. Just last month, only about 7% of adults had gotten the new COVID vaccine. I was seeing headlines calling that abysmal. It seems like new data is showing that's now up to about 14%. You would know that, Dr. Wong. So here is what's interesting to me. I talked to a couple people, again, in the Village District, and they seem like the interest in this vaccine was a bit low. Take a listen. Do you mind me asking, have you gotten the latest COVID vaccine?
I have not gotten the latest COVID vaccine.
Do you plan to?
I do plan to, along with the flu vaccine.
And are you just waiting? Like, why haven't you gotten it yet?
That's a good question. I think just schedule-wise and trying to schedule going and getting it. I did have a little bit of trouble with the last vaccine, and so I have been a little reluctant, but I know that the right thing to do is to get the vaccine, and so I need to put that on my priority list right now.
So there's a new COVID vaccine. Have you gotten vaccinated with that one?
No, I have not.
Do you plan to?
I hadn't really given it a whole lot of thought. I've gotten my flu shot, and I've gotten the other 2 doses of the COVID shot. I feel we're just back to, COVID's just another flu now. So I'm not sure.
So, Dr. Wall, here's the question. Is it urgent for people to get this new COVID vaccine? Do you think that the messaging around it reflects that?
Yeah, well, I'm a big vaccine booster, but I would say it's not as urgent, certainly, as the previous versions of the vaccine, the previous doses that have been recommended. And we have the luxury right now of being where we're at, and it's through the hard work of lots of people, including the other people you have on the show, Dr. Wong and Dr. Southwell and CDC and others. So we're in a nice spot where we have a lot of immunity built up, and so the urgency isn't as great as it was before. So I think people, of course, a lot of people have been infected recently. A lot of people had Omicron, so they have some natural protection, and other people have had all, 3, 4, 5 shots. So I understand walking, not running to get the vaccine. Look, I think that this is a vaccine that, as you can hear even from the comments you heard, once we get this more routinized, once it becomes an annual shot, this gets back to messaging. Once we get the messaging from the CDC, who is really the source of truth, this is really where we need to look to. This is where physicians, clinicians, and the public look to. But that trust was eroded partly due to the politicalization of the CDC, the harnessing of messaging elsewhere, not put into the CDC's bucket. So I feel really we've got to imbue the CDC, let the CDC be the CDC, let it be the source of truth, and get the messaging out there. And I think once things become a little bit more routine, you heard that person say, well, I get my flu shot every year. I think once the COVID-19 shot comes out as an annual shot, people will be more likely to take it, especially those who really need to take it. When you talk to folks who are older, they are planning to get it or have gotten it because they really feel that risk is there for them. Where younger people, you can understand, may not be as sort of motivated to take the shot to protect themselves from getting sick.
Very, very true. All right, coming up, we're going to talk about the aggressive steps that the medical community is taking right now to gain back the public's trust. Stay with us. Welcome back. All right, let's turn now to the role that misinformation is playing in declining trust. Dr. Southwell, last week you held a forum with some top medical minds in this country, and you all were talking about combating misinformation head on. Sometimes I feel like misinformation is happening so aggressively, and yet public health is coming on with a softer approach. What were the big takeaways, and is that approach going to work anymore?
Yeah, I think our first step that we've decided on is actually not to necessarily think about this as combating misinformation, but rather thinking about in a proactive and positive way, what can we be doing to reach out and serving audiences, serving patients in different ways. We brought together medical and healthcare leaders, public health officials from all over the country, here RTI International and Duke and the Coalition for Health, Trust in Health and Science, which is a new 80 90 organization coalition that's decided that what we can do is work together to collaborate, to try to figure out how we can do a better job of listening to what it is that patients need, of trying to acknowledge all the different myriad reasons why people are making these decisions, and what can we do to foreground credible information. Most people like and want good and credible information. They don't necessarily want misinformation. In fact, when they're drawn to it, they don't realize that it is false claims that they're paying attention to. So what can we actually do to better serve people where they are and to answer the questions that they have? And that's something I think together many organizations can do that.
I want you all to hear something that one gentleman had to say. How do you manage all that information that's out there and know what's true or not?
You really can't. You just really have to sift through and see what makes sense to you. If you want to do a little background on it and check up and go back and forth and like do research, go online, even online, you're still not going to find the truth. It's so many different. Who do we trust is the question. Who do we trust?
Who do you trust?
God.
Okay. I mean, how do you respond to that type of response, right? Where it seems like, well, you have this side, and we don't know which is real. We don't know which is true. There is truth.
There sure is. And again, I go back to working to figure out who's that person's trusted voice, trusted messenger. Often it's a healthcare provider, maybe a community health worker, going online and looking at reputable sources of information. Dr. Southwell, I like the way that you said it, right? We really want to flood the arena, the ecosystem that people are in with good information and direct them to folks who have that good information. That's why, because we know healthcare providers are such an important trusted source for folks, we're focusing our efforts with them at CDC this year. Again, and like he said, like you were saying, Dr. Southwell, listening also to what it is providers are saying that they need this year, because they're hearing different things this year from their patients, different types of questions, different barriers. And so we're listening to them, working with them to develop those materials. It's really all about working together in a team sport, particularly to combat some of the misinformation and just making sure we're there to answer questions that folks have.
We don't have time to, I think we do. Let's just listen to one more gentleman's comment. It's a positive one. Take a listen, Dr. Wall.
Maybe meet people where they are and let them know that we don't know everything, but we're doing the best that we can do, and we're trying to keep our population healthy, and that, the buy-in will come when everyone realizes that we need each other.
Dr. Wall, I thought that was so well said. Do you think that's exactly what needs to happen?
I do, and I have to give you credit, and I have to give WRAL credit and other media outlets in North Carolina particularly that have spent a lot of time on this, have done programs like this one, and really tried to disseminate information in a very clear way. I know we don't always have, 3 minutes to explain things. It's often only about a minute, but you all have paid a lot of attention to this. I'm a little bit more cynical maybe than your other guests. I think that there's a lot of disinformation out there that's put out there intentionally to confuse people. And it is really hard, and I will say, to fight or combat it, because I think we have to. There's no immunization against doubt casting messaging. And we don't have the money in our budget.
I have to let you go. I would talk to you for an hour. Doctors Wong, Wall, and Southwell, thank you so much for your time. If you have any comment, find me on social media. Have a good night.